This video series has been developed to help you better understand critical health hazards associated with lead-containing paint, or LCP, encountered in construction and related industries. LCP is a common material found in older structures and buildings, and its presence may not be immediately obvious upon first inspection. When LCP is not handled correctly, it can present a serious risk to human health. Lead was historically used in paint for its durability, colour pigments, appearance, and its ability to dry quickly. It was widely used in construction throughout Australia within and surrounding homes, public buildings, and industrial structures before its negative effects were fully understood. While LCP was phased out in the 1970s and 1980s, it can still be found in many buildings constructed before 1997, often as an undercoat beneath modern paint. When these painted surfaces are disturbed through activities such as sanding, scraping, heating, or demolition, they can release a fine dust, fumes, or chips which contain lead. It is these lead dusts and fumes that present the highest risk to health. Any paint that contains more than 0.1% elemental lead in total is considered to be LCP. Lead is a heavy metal known to have a variety of toxic effects in humans when it enters the body. Inhalation of fine dust or fumes released when LCP is disturbed is the most common pathway of exposure. Fumes generated by heat are especially hazardous as they are more easily absorbed than dust. Lead is considered a bioaccumulative poison, meaning that it is not easily eliminated from the body, but instead builds up over time, gradually reaching levels which can cause adverse health effects. Lead initially binds to red blood cells when ingested, before distributing itself throughout soft tissues, such as the brain, lungs, liver, and kidneys. It eventually begins to accumulate in bone tissue and teeth, where it can remain for decades and re-enter the bloodstream during periods of physical stress or bone remodeling. Even relatively low levels of lead in the blood can trigger early symptoms such as headaches, fatigue, irritability, nausea, and stomach pain. Long-term exposure to lead can lead to a range of severe health effects, including damage to the nervous system, leading to cognitive impairment and behavioural issues, lung cancer, kidney damage and impaired kidney function, anemia and other blood disorders, reproductive issues including reduced fertility in both men and women, and gastrointestinal problems such as abdominal pain and constipation. Workers most at risk of exposure are those involved in tasks that disturb LCP, with some common examples being demolition or renovation of older buildings or structures, or paint removal processes such as sanding, scraping, or abrasive blasting. It should also be noted that short-term, high-intensity exposure to LCP can lead to acute lead poisoning affecting workers of all ages. Exposure to LCP is exacerbated by poor personal hygiene practices. Lead dust can easily be transferred from hands to mouth, leading to ingestion. Studies indicate that inadequate washing of hands and face before eating, drinking, or smoking, and not changing contaminated clothing before leaving the worksite, significantly increases the risk of lead absorption. This makes thorough hygiene practices important for anyone working with LCP. LCP is a prevalent issue in older buildings, however, exposure to lead is a preventable occupational hazard. Understanding where it originates and the long-term consequence of unmanaged exposure is essential for protecting the health of yourself and your colleagues. In our next video, we'll explore how to effectively control lead dust, including the legal exposure standards, hierarchy of controls, and monitoring methods used in the workplace.